let's chat about something that affects every step we take, our joints. Have you ever wondered why your joints sometimes make noise or feel a bit off? Do you think about how to keep your knees, hips, or shoulders happy and healthy? Well, guess what? You're not alone. How do you make sure your joints feel good and move smoothly? What questions pop up in your mind when you think about your joints? Share your thoughts, stories, and any questions you have. We're here to talk about joints, answer your questions, and make sure your joints are feeling their absolute best. Let's kick off this chat about joint health. Meet Jenny, a lively and healthy person who works at a busy bank. Recently, her knees started causing her some trouble. Concerned about this, she decided to see a special doctor to figure out what was going on. The doctor suggested a few tests, like blood tests and a bone scan, to get a closer look. Anxiously waiting for the results, Jenny found herself in the doctor's office, hoping for some answers. When the news came in, she learned that she has osteoarthritis. Curious and a bit worried, she turned to the doctor to learn more about this condition. In simple terms, the doctor explained that osteoarthritis happens when the cushion-like layer in your joints wears down over time, making your bones rub against each other. Jenny, wanting to know more, asked the doctor how to deal with this new health discovery. The doctor reassured her by answering her inquiries. Doctor, what is osteoarthritis? Osteoarthritis is the most common type of arthritis, a condition that affects your joints. Healthcare providers sometimes refer to it as degenerative joint disease, or OA. It happens when the cartilage that lines your joints is worn down over time and your bones rub against each other when you use your affected joints. Usually, the ends of bones in your joints are capped in a layer of tough, smooth cartilage. Cartilage is like a two-in-one shock absorber and lubricant. It helps the bones in your joints move past each other smoothly and safely. If you have osteoarthritis, the cartilage in your affected joints wears away over time. Eventually, your bones rub against each other when you move your joints. Osteoarthritis can affect any of your joints, but most commonly develops in your hands, knees, hips, neck, cervical spine, and lower back, lumbar spine. A healthcare provider might classify osteoarthritis as one of two types. Primary osteoarthritis is the most common form of osteoarthritis that develops in your joints over time. Experts think it's usually caused by normal wear and tear of using your joints throughout your life. Secondary osteoarthritis happens when something directly damages one of your joints enough to cause osteoarthritis. Injuries and traumas are common causes of secondary osteoarthritis. Other types of arthritis can damage the cartilage in your joints enough to cause osteoarthritis, too. Doctor, how common is osteoarthritis? Osteoarthritis is very common. Experts estimate that more than 80% of adults older than 55 have osteoarthritis, even if some of them never experience symptoms. Around 60% of people with osteoarthritis have symptoms they can notice or feel. Doctor, what are osteoarthritis symptoms? The most common symptoms of osteoarthritis include pain in a joint, especially when you're moving it, stiffness, swelling near a joint, a decreased range of motion, how far you can move a joint, feeling like a joint isn't as strong or stable as it usually is, and a joint looking noticeably different than it used to, joint deformity. Doctor, what causes osteoarthritis? Experts aren't sure what causes osteoarthritis. Primary osteoarthritis usually develops slowly as you age. As you get older, normal wear and tear on your joints might contribute to their cartilage breaking down. Anything that directly damages your joints can also cause osteoarthritis, including sports injuries, falls, car accidents, and health conditions that affect your joints, like Ehlers-Danlos syndrome or joint hypermobility syndrome. Other forms of arthritis, specifically inflammatory arthritis, can cause osteoarthritis, including rheumatoid arthritis, gout, and psoriatic arthritis. Dr. War are the osteoarthritis risk factor. Anyone can develop osteoarthritis. Adults older than 55 and people who are in postmenopause are more likely to develop osteoarthritis. People with certain health conditions are more likely to experience osteoarthritis, including obesity, having a body mass index, or BMI, greater than 30, or overweight, having a BMI over 25, diabetes, and high cholesterol, hyperlipidemia. Doctor, how is osteoarthritis diagnosed? A healthcare provider will diagnose osteoarthritis with a physical exam and imaging tests. They'll look at your joints and ask you when you first noticed any symptoms. Tell them if any activities make your symptoms worse, or if they come and go. Doctor, what tests are done to diagnose osteoarthritis? Your healthcare provider might use X-rays to take pictures of your joints. They might also use an MRI, magnetic resonance imaging, or CT, computed tomography, scan. You might need blood tests to rule out other conditions or issues that cause similar symptoms. Doctor, how is osteoarthritis treated? Your healthcare provider will help you find treatments that relieve your osteoarthritis symptoms. There's no cure for arthritis, and you can't regrow the cartilage in your affected joints. Your provider will help you find ways to manage your symptoms when you're experiencing them. The most common treatments for osteoarthritis include medication, exercise, supportive devices, heat and cold therapies, complementary therapy, and surgery. Doctor, how can I prevent osteoarthritis? The best way to prevent osteoarthritis is to maintain good overall health, including avoiding tobacco products, doing low-impact exercise, following a healthy diet plan, always wearing your seatbelt, wearing proper protective equipment, and visiting a healthcare provider for regular checkups and as soon as you notice any changes in your joints. Doctor, what can I expect if I have osteoarthritis? Most people with osteoarthritis need to manage their symptoms for the rest of their lives. If you have osteoarthritis, it's important to stay as active as possible. If joint pain and other symptoms make it too hard for you to move, you may face a greater risk for other serious health conditions like heart disease, diabetes, and some types of cancer. Talk to your healthcare provider if osteoarthritis makes it hard, or impossible, to stay active. They'll help you find new treatments to manage your symptoms. Doctor, what can I do to make living with osteoarthritis easier? You might need to tweak your routine to make living with osteoarthritis easier. Depending on when you're experiencing symptoms, and how severe they are, you may need to avoid or modify your activities while you're managing symptoms. You might work with an occupational therapist if you need help performing your daily tasks. Occupational therapists are healthcare providers who can help you manage physical challenges like arthritis. They may recommend adaptive equipment, techniques for doing hobbies, sports or other activities safely, and tips for reducing joint pain during arthritic flare-ups. With this new knowledge and a plan in hand, Jenny left the doctor's office. Now, she's ready to face her bank job with the same energy, armed with ways to take on osteoarthritis. And so, Jenny's health journey takes a turn, with each step focused on staying vibrant while managing osteoarthritis. We've had a nice chat about keeping our joints in good shape. Now, let's think about someone like Jenny, who might not have been taking the best care of herself. Did you pick up some helpful tips today about looking after your joints? Maybe you've got stories or questions to share, and we're all ears. Here's a little invitation: why not subscribe for more heartwarming tips and stories? Let's support each other in keeping our joints feeling their best. Can't wait to continue this journey together.